Hi, my name is Cammie Evans. I am a stress management coach, and I wanted to take a couple of minutes and do a quick tapping video for physical pain. This is one of my very favorite things among so many things that I love about EFT is its ability to reduce pain. On average, the research shows that your pain can reduce by as much as 60%. And so while I am a advocate of medical care as a radiographer, as a radiation therapist with almost 20 years of experience in frontline healthcare, there are so many emotions that get wrapped up in our physical pain. And so if we can start to bring some of that down, that may make the difference between a narcotic pain medicine versus something a little more mild. And so while this is not the time or the place to do any really deep or specific tapping, it may be enough to just take the edge off, or it may be even really successful in relieving a lot of pain. So it just kind of depends on how you're feeling. We're going to jump right in. And the important thing with this is to really lean into that pain. And I know that's a little bit challenging to do if you're in a lot of pain. So, of course, please seek appropriate medical care. This is not a substitute for medical care. This is a complementary technique. You do this in addition to, is what that means. So we're going to just kind of sit with those feelings. And I want you to notice where you feel that physical pain in your body. And it may not be physical pain. It even could be something like, my liver isn't functioning really well. Or, I have a skin condition. That's why my skin gets red when I do tapping. Just something that's kind of bugging you a little bit. I want you to tune into that feeling. And we're going to begin to describe it. And I want you to imagine maybe like a little camera on the side of, your thumbnail. And I want you to imagine it goes in your ear and it goes down into your little body and it goes to where that area of pain is. And you're just tapping on one point for a minute, or maybe not at all, as you see where that little camera that went in through your ear, see where it goes. And I want you to see that area in your body that's hurting. And I want you to describe it. And if you need to, you can write it down on a piece of paper, what you see. And this could be very medical, very, factual as far as what your body looks like. Or it could be very, very metaphorical, this burning red pain, or maybe this cauldron of whatever boiling in my stomach, or maybe I feel like my back is tied up in knots. Whatever it looks like for you, I want you to tune into that, and we're going to begin tapping on it. And it's going to sound very repetitive, but it's very important to state the truth of what we see and how we feel. So I want you to describe it as we tap through the points. And I'm going to try and be quiet while you describe what's going on in your body. I'm going to give the occasional example in case you're a little bit lost. My back is tied up in knots. I feel like there's a knife in my back. My head is being squeezed in a vice. There's no wrong or right answer. Whatever you see or feel in your body, and you can just say that over and over again. There's a knife in my back. So much tension in my chest. And if it is something like tension, I want you to see, or anything that you're feeling, How big is it? How dark or red, the color, is it really black? Is it dark, bright red? As we go through the points, I want you to notice if that changes. How big is the knife in your back? How big is that ball in your throat? That feeling in your stomach. If your pain is going up, that's actually a really good sign that we are right on the target. We are simply tuning into our bodies. As we calm our nervous system and tell our brain that we are safe. Checking in. You can stop tapping for a minute, and I want you to check in. Look at your camera again, that little invisible camera that went in through your ear. What does it see now? As you breathe into this feeling, as you're tuning in, has it changed? Did the pain go up and then come down? As long as you are specific on this one area at a time, then you're doing this correctly. We're going to start tapping again. Even though there's still some pain there, I can see that it has come down. Even though I really doubted that this would help. Something did happen, and it surprised me. I was surprised that I could see a picture inside my body. And I'm open to releasing a little bit of this pain. And we're going to address the resistance. Often that pain, if it's chronic, is protecting us from something. So please bear with me as I just voice any resistance that may be there. I don't want to release this pain. And I know that doesn't make any sense because I don't want the pain. It doesn't feel safe to release this pain. This pain keeps me from having to see who? This pain keeps me getting my disability check. This pain means I don't have to go to work tomorrow. Does any of that resonate? Or is there another reason that's coming up for you? Breathing into whatever that reason is. Just giving ourselves a little compassion because this pain is trying to protect me, us, you. I don't want to go to work tomorrow. I don't want to see my relatives. I don't want to dot, dot, dot. We're simply acknowledging the truth of what's coming up. And some of this is actually a little bit illogical. You may not have even realized that you felt that way. And that's okay. All of this pain, I'm open to letting a little bit of it go now. In fact, let's do one more round. And this is what we call sneaking away. There's a very good chance that your pain did not go down to zero. And in case you are in that boat, I don't want to leave you hanging like, oh, she opened all this up and now I feel really crappy about myself and I still have this pain. So this is called sneaking away. And we're going to tap on the side of the hand. That was really interesting to see how my pain shifted. But I'm open to giving myself compassion because I didn't realize the emotions that were involved. Maybe my pain went down a little bit. And for that, I'm grateful. But if it didn't, that's okay too. Maybe my pain is more complex than a 12 or 15-minute video can take care of. And that's okay. This pain in my body, there's more to it than just aging or injury. I didn't realize that emotions were involved as well. So I give myself compassion because I have been through a lot. And I don't have to figure it all out today. I don't have to make this pain go to a zero today. Maybe I can give myself a break because I have been trying my hardest. And I don't have to figure it out today. I've done enough. Maybe I can allow my body to rest. Give my body a break or some grace or compassion. Take a deep breath. Make sure you're taking, plenty of water because we are sending that electrical signal to our brain. And if you're finding that tapping isn't working, like it's not calming things down, one of the things that you can do is take some water to see if that will help. I hope this helped a little bit. I hope your pain did go down a little bit. I wish you the very best. I hope you have a wonderful day. Thank you.